Good morning, wherever you are. This is Miles Carter from ConferenceHype. Our segment will focus on dose-aware 5-star image quality rating in CT, findings from the IAEA-MGH study. From the 2026 August 5 edition of European Journal of Radiology. Background: photon-counting CT can generate virtual monoenergetic images and effective atomic number, demonstrating considerable potential for tissue quantification. Methods: an adult male anthropomorphic abdominal phantom was scanned using PCCT. Results: across all protocols, VMI attenuation showed excellent correlation with the reference protocol. Discussion: pitch exerts the greatest influence on the stability of VMI CT numbers, whereas tube voltage and IQ level have relatively minor effects. From the 2026 August 5 edition of European Journal of Radiology. Background: to systematically compare the diagnostic accuracy of abbreviated breast MRI and full diagnostic protocol MRI for breast cancer detection. Methods: Ovidemi-DLINE, EMBUS, Cochrane Library, and Web of Science were searched up to December 1, 2025. Results: 40 studies were included. Discussion: the diagnostic performance of AB MRI protocols relative to FDP MRI varies by protocol and clinical setting. Findings apply only to the specific regimens evaluated. From the 2026 August 6 edition of European Journal of Radiology. Background: invasive lobular carcinoma is the second most common subtype of breast cancer after invasive carcinoma of no special type, previously referred to as invasive ductal carcinoma. Methods: loss of E-cadherin-mediated adhesion drives its characteristic diffuse infiltration, producing subtle or ill-defined lesions on imaging and contributing to underdiagnosis. Results: ILC demonstrates a distinctive metastatic tropism, with a higher prevalence of peritoneal, gastrointestinal, ovarian, and leptomeningeal involvement than NSD, whereas pulmonary metastases are reported less often. Discussion: increased awareness of these patterns and need for dedicated imaging approach among radiologists and nuclear medicine physicians is necessary to reduce missed or late diagnoses. From the 2026 August 7 edition of European Journal of Radiology. Background: this study aimed to investigate the diagnostic value of 5-phase high-resolution contrast-enhanced CT for pancreatic diseases. Methods: a retrospective study involving 1886 patients with pathologically confirmed pancreatic disorders was performed with non-randomized protocol allocation according to clinical indications. Results: HRCT was associated with a significantly higher report-level concordance with pathology for pancreatic diseases than CCT, with an absolute increase of 11.2%. Discussion: 5-phase HRCT was associated with significantly higher report-level concordance with pathology for pancreatic diseases in this retrospective cohort, particularly for the detection of small PDAC. From the 2026 August 5 edition of European Journal of Radiology. Background: immune checkpoint inhibitors have transformed melanoma treatment, but reliable prognostic biomarkers are lacking. Methods: we retrospectively analyzed 73 patients with metastatic melanoma treated with ICI who underwent baseline abdominal DECT. Results: associations between baseline MNIC and shorter PFS increased from core to periphery. Discussion: peripheral tumor iodine concentration on dual-energy computed tomography independently predicts both shorter progression-free survival and greater new lesion burden in immune checkpoint inhibitor-treated metastatic melanoma. From the 2026 August 5 edition of European Journal of Radiology. Background: carbon monoxide poisoning often leads to acute brain injury and delayed neuropsychiatric sequelae, resulting in heavy social and economic burdens. Methods: conventional imaging can detect gross structural lesions, and acute brain lesions on routine MRI are an established biomarker for predicting DNS. Results: diffusion tensor imaging and diffusion kurtosis imaging can both assess microstructural damage of cerebral white matter. Accumulating observational data suggests that kurtosis-derived metrics may yield higher sensitivity for detecting subtle white matter injuries. Discussion, given the limitations of existing single-center, small sample, and cross-sectional studies. Further multi-center, longitudinal, and multimodal investigations are needed to optimize predictive models and improve the diagnosis, treatment, and mechanistic research of COP. From the 2026 August 6 edition of European Journal of Radiology. Background: pain is the hallmark of knee osteoarthritis and a major cause of disability. Methods: this study used the foundation for the National Institutes of Health Osteoarthritis Biomarker Consortium dataset from the Osteoarthritis Initiative for Model Training and Holdout Validation, while the pivotal OAI-MRI analyses dataset was used for independent validation. Results: the baseline IPFP radiomics model exhibited stable predictive performance, with AU-CIROC values of 0.731 and 0.732 in the holdout and independent validation sets, outperforming clinical and MOAKS models. Discussion: quantitative MRI radiomics of the IPFP provide a promising tool for predicting COA pain progression. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 5 edition of European Journal of Radiology. Background: to evaluate whether reduced iodine photon counting CT virtual monoenergetic imaging provides comparable quantitative and non-inferior qualitative image quality compared with standard iodine energy integrating detector CT in portal venous phase abdominal imaging, and to identify the optimal key V range. Methods: this retrospective study included 84 adult patients who underwent abdominopelvic PCCT using a lower concentration iodinated contrast medium administered at the same injection volume as routine practice, resulting in a reduced total iodine dose, and who had a prior conventional ECT performed with standard contrast medium within 1 year. Results: the total iodine dose was significantly lower in the PCCT group than in the ECT group. Discussion: our IPCCT provided comparable quantitative and non-inferior qualitative image quality compared with SI-EIDCT, while lowering the iodine and radiation dose. From the 2026 August 10 edition of European Journal of Radiology. Background: to evaluate the role of US-guided vacuum-assisted excision in the management of imaging histological discordant lesions after core needle biopsy, avoiding unnecessary surgical excision. Methods: we retrospectively evaluated all patients who underwent US-guided VAE with a 9G needle between January 2015 and August 2023 for imaging histological discordance after CNB. Results: we collected data from 334 patients. Discussion: VAE reduces the risk of underestimation of associated malignancy in imaging histological discordant lesions and increases diagnostic accuracy, thus reducing the need for surgery without compromising the quality of patient care. From the 2026 August 13 edition of European Journal of Radiology. Background: to evaluate the diagnostic performance of low-field 0.55T knee magnetic resonance imaging with and without deep learning-based image denoising techniques compared to conventional 3T MRI. Methods: this retrospective study included 33 knee MRIs from 26 patients with knee pain who underwent both 0.55T and 3T MRI. Results: 0.55T without DL showed a moderate sensitivity of 0.83, a specificity of 0.82, and an overall diagnostic accuracy of 0.83. Discussion: DL-based denoising of 0.55T knee MRI significantly enhances the diagnostic performance, demonstrating results comparable to conventional 3T, which were not achieved with 0.55T MRI alone. From the 2026 August 10 edition of European Journal of Radiology. Background: to evaluate the effectiveness of deep learning-based reconstruction for improving image quality and reducing scan time in multi-shot diffusion-weighted imaging of the breast, compared with standard readout-segmented echoplanar imaging. Methods: this retrospective study included 146 women with newly diagnosed breast cancer who underwent preoperative breast MRI with both RS-epi and prototype DL-reconstructed multi-shot DWI. Results: compared with RS-epi, DLR multi-shot DWI demonstrated significantly higher SNR, CNR, and lesion contrast at both B equals 800 and synthetic B equals 1500 SM2. Discussion: DL-based reconstruction improves quantitative and qualitative image quality in multi-shot breast DWI while reducing scan time. That's it for now for ConferenceHype's coverage of the August 2026 issue of European Journal of Radiology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.